Right now, inside your chest, the microscopic tethers holding your heart valves together are snapping. Your spinal discs are quietly dehydrating into dust, and the very walls of your arteries are losing their grip. This catastrophic, invisible erosion is happening every single second you sit there, and it is the true reason you feel old, stiff, and fragile. But the medical establishment has you completely distracted. They have you rubbing overpriced, luxurious creams onto your face and swallowing giant, chalky joint pills you bought at the grocery store, believing you are protecting yourself. You are not. In fact, those unquestioned daily habits are completely useless against the systemic collapse happening deep inside your cells. I'm a veteran physician and I am refusing to stay silent anymore while my patients suffer needlessly. The truth is, the fundamental structural steel of your body is rusting away, and the standard clinical protocols are doing absolutely nothing to stop it. The multi-billion-dollar anti-aging and pharmaceutical industries have pulled off the greatest magic trick in modern medical history. They have convinced you that agonizing joint pain, wrinkled paper-thin skin, and declining heart health are just normal, unavoidable parts of getting older. So, what do? They hand you non-steroidal anti-inflammatory drugs to mask the burning in your knees. They prescribe chemical blood pressure medications to force your stiffening arteries to relax. They sell you topical cosmetics and injected fillers that do absolutely nothing but temporarily plump the surface of a dying structure. This is deeply concerning, and quite frankly, it is fundamentally flawed. These standard treatments are nothing but a band-aid on a bullet hole. They are masking the symptoms while the root cause silently destroys your body at the cellular level. That root cause is the severe, unchecked depletion of your body's master scaffolding, a vital protein matrix that makes up nearly 1/3 of your entire physical mass. It acts exactly like flexible steel cables inside a building, keeping your skin firm, your joints fluid, your bones resilient, and your blood vessels pliable. But by the time you reach 40, your production of this molecule plummets, setting off a systemic breakdown. Before I reveal exactly how to reverse this internal collapse, I need to know exactly who I am speaking to today. Pause this video right now, go down to the comments, and type your exact age, your city, and the specific joint or area of your body that is causing you the most pain this week. Drop that below so I can provide personalized insights. Let me tell you about Arthur. Arthur was 72 years old, and by all conventional medical standards, he was the perfect patient. He meticulously followed his doctor's strict low-fat diet. He took his prescribed statins and beta blockers without fail. He even spent a small fortune on the latest topical collagen creams his wife bought him, hoping to smooth out his skin and strengthen his easily bruised, fragile hands. But then the catastrophic event occurred. Arthur suffered what should have been a very minor slip in his garden. Instead of a simple bruise, he sustained a massive spontaneous rupture of his Achilles tendon, accompanied by a sudden onset of terrifying, irregular heartbeats. In the emergency room, the doctors simply shrugged. They blamed his age. They called it standard wear and tear. They handed him a prescription for heavy painkillers, slapped a rigid boot on his leg, and told him to go home and rest. That was the false diagnosis. When Arthur was wheeled into my clinic, I looked past his medical chart and looked directly at his cellular reality. The true diagnosis was glaringly obvious. Arthur's body was structurally bankrupt. His internal scaffolding was completely gone. The topical cosmetics he was rubbing on his skin were fundamentally useless because those molecules are simply too large to penetrate the epidermis and rebuild the internal structural layer. Furthermore, his so-called healthy diet was entirely devoid of the specific amino acids required to weave new tissue. His tendons didn't just tear, they shattered like dry, brittle twigs. And his irregular heartbeats weren't a standalone cardiac disease. The actual valves of his heart, which rely heavily on this exact structural protein to open and close tightly, were becoming dangerously floppy. We immediately threw out the useless creams and stopped the generic symptom masking advice. I put Arthur on a very specific biologically active structural rebuilding protocol. Within 6 weeks, the transformation was genuinely impressive. His tendon healed at a rate that completely baffled his physical therapist. His heart rhythm stabilized without increasing his medication. His skin lost its translucent, paper-like appearance and became firm. He didn't just recover, he rebuilt his biological armor. We are going to count down the 6 non-negotiable steps to naturally force your body to rebuild its internal steel cables, starting from number 6 down to the most powerful ultimate fix. Pay close attention, because missing even one of these metabolic steps renders the others completely useless. Number 6, the mechanical mandate. When your joints hurt, conventional wisdom tells you to rest. You sit down in your recliner, you take a pain pill, and you avoid putting stress on your knees and shoulders to save them. This is the false benefit. Biologically, this is the absolute worst thing you can possibly do. Your body's tissue-producing cells are called fibroblasts. These vital cells rely entirely on a process called mechanotransduction. They only secrete new, fresh structural proteins when they detect physical tension and stretching signals. Without mechanical load, your fibroblasts go completely dormant. Think of your body like a major construction site. The fibroblasts are the workers. If there is no demand for a new building, no mechanical stress to signal a need for strength, the workers simply go to sleep on the job, no cement is poured, no steel is laid. A 2023 study published in the Journal of Geriatric Health found that seniors who engaged in zero resistance training experienced a 41% faster degradation of their articular cartilage compared to those who lifted even light weights. This lack of mechanical signaling triggers a devastating cascade effect. It leads to rapid sarcopenia, muscle wasting, which destabilizes the joints entirely. The joints grind bone on bone, eventually leading to a catastrophic fall and a total permanent loss of independence. You must engage in resistance training. I am talking about light weightlifting, resistance bands, or modified push-ups. But here is the metabolic rule. You must perform these movements in the morning on an empty stomach to maximize the localized growth hormone response in your joints. But if you thought resting was destroying your joints, wait until you hear how you are quietly dissolving them in your sleep at number 5. Number 5, the cortisol flush. You take over-the-counter sleep aids to force yourself to pass out, or you just push through the chronic stress of the day with sheer willpower and caffeine, thinking you are being tough and productive. That is the false benefit. When you are chronically stressed and sleep deprived, your adrenal glands pump out massive amounts of cortisol. Biologically, cortisol is severely catabolic. It actively dismantles the peptide bonds in your connective tissue. Furthermore, missing out on deep, slow-wave sleep means you entirely bypass the critical nighttime window where your pituitary gland releases human growth hormone, the only hormone capable of triggering the repair of daily micro damages in your connective tissue. High cortisol is wreaking absolute havoc on your cells. It is like pouring battery acid directly onto those flexible steel cables. It literally eats through the structural integrity of your body while you lie awake. Clinical data clearly shows that individuals sleeping less than 6 hours a night exhibit a 30% reduction in systemic connective tissue density over a 5-year period. This acid bath of stress hormones triggers systemic inflammation, accelerating the visible, deep wrinkling of your skin and causing microscopic tears in your blood vessels, which your body then desperately tries to patch with dangerous cholesterol plaques. You must prioritize deep, unmedicated sleep. The repair state is non-negotiable. Stop eating at least 3 hours before bed to lower your core body temperature and ensure your room is pitch black to maximize natural melatonin production, which acts as a profound, localized antioxidant for your skin and joints. Sleep sets the stage, but what you feed those cells next dictates if the structure will actually hold. Let's look at number 4. Number 4, the master catalyst. You take massive synthetic multivitamin pills packed with thousands of milligrams of artificial ascorbic acid, thinking you are boosting your immune system and doing your body a favor. That is the false benefit. Synthetic vitamins are poorly absorbed and largely excreted. But more importantly, true food matrix, vitamin C, is the absolute non-negotiable cofactor for the enzymes prolyl hydroxylase and lysyl hydroxylase. These specific enzymes are responsible for stabilizing the triple helix structure of the structural protein molecule. Without vitamin C, the protein chains cannot twist together tightly. They remain weak, fragmented, and functionally useless. Imagine trying to build a skyscraper. You have all the steel beams delivered to the site, but you forgot to hire the welders. Vitamin C is the welding torch. Without it, the beams just fall apart under their own weight the moment the wind blows. A landmark 2021 clinical review demonstrated that natural dietary vitamin C intake is directly correlated with a 27% decreased risk of severe skin wrinkling and a massive reduction in joint space narrowing in the elderly. A microdeficiency in this catalyst leads to subclinical scurvy. You won't lose your teeth immediately, but your gums will begin to bleed. When you brush, you will bruise easily from minor bumps, and the microscopic valves in your heart will begin to warp and fail. You need bioavailable vitamin C from whole foods, strawberries, tomatoes, bell peppers, broccoli, and kiwi. Here is the strict rule for metabolic synergy. Vitamin C is highly volatile and easily destroyed by heat. You must eat these foods raw, at room temperature, never boiled or baked into submission. You have the welders on site, but now you need the specific type of industrial bolts to lock the structure in place. That brings us to number 3. Number 3, the sulfur sealant. You force yourself to eat sad, watery iceberg lettuce salads because you were told they are low calorie and good for digestion, entirely missing the actual structural nutrients your aging body is begging for. That is the false benefit. We need to talk about sulfur. Dark green leafy vegetables like spinach, kale, and bok choy are incredibly rich in this vital mineral. Biologically, sulfur is required for the synthesis of glycosaminoglycans and for creating disulfide bonds. These bonds cross-link the protein fibers together, exponentially increasing their tensile strength and durability against the friction of daily movement. If vitamin C is the welding torch, sulfur is the heavy-duty industrial bolts that lock the steel beams together. Without the bolts, the structure might stand upright in a gentle breeze, but it will absolutely collapse during an earthquake. Geriatric patients with depleted organic sulfur levels show a nearly 50% increase in arterial stiffness, drastically raising the risk of spontaneous strokes and vascular events. Without sulfur to stabilize the tissue, the blood vessels lose their youthful elasticity. They become rigid, calcified pipes. Your heart has to pump twice as hard to push blood through, skyrocketing your blood pressure and exhausting your cardiac muscle. Incorporate bok choy, kale, or spinach into your diet daily. But to unlock the maximum bioavailability of the nutrients without destroying them, you must lightly steam them for exactly 3 to 4 minutes. Never eat them totally raw in massive quantities, as oxalates can bind to the nutrients, and never ever boil them to mush. Now we are getting to the actual raw materials. If you mess this up, nothing else matters. Pay close attention to number 2. Number 2, the bioavailable matrix. You spend a fortune on highly processed, artificial, sugar-loaded Jell-O cups or prepackaged commercial supplement powders, assuming you are magically feeding your joints. This is a massive false benefit. Most commercial powders and sweet gelatin snacks are subjected to extreme heat, artificial dyes, and harsh acids during manufacturing. This completely denatures the very amino acids, glycine, proline, and hydroxyproline, that you are paying for. What your body actually requires is pure, unflavored gelatin. Gelatin is simply the cooked, highly digestible form of structural protein. When consumed, it bypasses the massive digestive energy required to break down dense muscle meats and delivers a flood of raw, perfectly proportioned amino acids straight into your bloodstream. Taking cheap, heavily processed powders is like trying to build a house by dumping a pile of useless sawdust onto the lot. Taking pure gelatin is like delivering perfectly pre-cut lumber directly to the waiting carpenters. A double-blind clinical study revealed that older athletes consuming pure gelatin enriched with vitamin C exactly 1 hour before activity showed a 200% increase in structural protein synthesis in their targeted joints. Let that sink in for a moment. Failing to provide these specific raw materials forces your body to cannibalize itself. It will literally strip the structural proteins from your skeletal muscle and intestinal lining to keep your vital organs running, leading to severe leaky gut and profound debilitating weakness. Buy pure, unflavored, grass-fed gelatin. Combine it with the fresh raw fruits we discussed earlier, like kiwi or strawberries, to make your own natural, sugar-free jellies. The metabolic synergy of taking the gelatin alongside the raw vitamin C guarantees maximum cellular uptake. But there is one final ancient protocol, the absolute gold standard of structural repair that modern medicine desperately wants you to forget. Number one, the ultimate elixir. You buy those little cardboard boxes of high sodium, ultra processed stock from the center aisles of the grocery store, throwing it into soups and thinking it has healing properties. That is the ultimate false benefit. Commercial stock is essentially salty water flavored with chemical yeast extracts. It contains zero structural proteins. The ultimate biological fix is authentic, long simmered bone broth. When you slowly extract the marrow, cartilage, and connective tissue from animal bones, you release a highly bioavailable matrix of intact glycosaminoglycans, hyaluronic acid, chondroitin, and the holy trinity of structural amino acids. Drinking authentic bone broth is the biological equivalent of a direct blood transfusion of youth to your starving cells. It is the exact uncorrupted blueprint your body needs to rebuild its own failing infrastructure. Clinical observations in integrative medicine repeatedly show that daily consumption of high quality bone broth accelerates tissue repair in post surgical senior patients by up to 40% compared to standard hospital diets. Burn that word into your head, accelerates. When you restore this specific nutrient profile, the systemic domino effect is miraculous. Your gut lining seals, systemic inflammation drops dramatically, your arteries regain their youthful elasticity, and the severe grinding pain in your knees and hips quietly vanishes. The result? Complete restoration of your mobility. You must make it yourself or buy frozen true bone broth from a reputable butcher. Simmer high quality bones for a minimum of 12 to 24 hours. And here is the absolute most critical rule. You must add exactly 2 tablespoons of organic apple cider vinegar to the water before simmering. The acetic acid acts as a chemical key, unlocking the dense bones and drawing the maximum amount of trace minerals and amino acids directly into the broth. Listen to me very carefully. The medical establishment might have told you that your deteriorating joints, your failing heart valves, and your fragile skin are permanent, inevitable life sentences. They are wrong. The human body possesses a miraculous, almost unbelievable capacity to heal and reverse cellular damage at any age, but only when you finally stop poisoning it and start giving it the exact biological building blocks it is screaming for. You are not destined to break down. Now, a strict word of clinical caution: do not stop any of your prescribed medications abruptly. That is highly dangerous. Instead, take this information, begin applying these dietary and lifestyle protocols immediately, and have an informed, highly educated conversation with your doctor to slowly taper off your symptom masking drugs as your body actively rebuilds its own internal strength. I need you to do something incredibly important right now. Think of one specific person in your life, a spouse, a sibling, a dear friend who is suffering right now, someone whose life and independence could be literally saved by understanding the truth about their body's internal structure. Share this video with them right this second. It is an act of profound altruistic love that could alter their trajectory forever. If you have stayed with me until the end and you are ready to take absolute command of your biological future, I want you to go down to the comments and type the exact phrase, "I finished the video." That tells me you are a serious individual taking your health seriously, not just a passive consumer of broken medical dogma. Remember, the medical industry thrives on your ignorance, but your true healing begins with knowledge. Your health is and always will be in your own hands.